is yung ability niya to penetrate the skin. So, please, worms, so, paano? So, paano ba nga nila? Hi, I'm Chua, your resident vet at New Valley. And we are here today as we talk about some of your interesting pet health concerns. Okay na yan. Okay na. Out. Ako naman. Out. Ako naman. Hello everyone! Welcome to the first episode of Q&A Friday. Again, I am Chua, your resident vet at New Valley. So the question we picked for this episode is all about preventative care. Actually, itong question na to, more on naging personal question na rin to sa ating mga clients. Somehow medyo nahihiya pa sila mag-drop ng question sa post natin last time. But today, we will talk about preventative care. So, ano nga ba ang preventative care? So, it includes mga healthcare measures na ginagawa natin para mapanatili nating healthy and maiwasan natin ang mga potential diseases sa ating mga alaga. Kasama dito ang wellness check, deworming, vaccination, heartworm preventives, external parasite control, and also diet and lifestyle. All of these are vital for us to maintain a well-balanced and healthy life for our pets. But today, we will focus more on vaccinations and deworming. Why is it important? Kailan natin ibibigay ito? Ano ang mga vaccine at deworming na gagamitin? At ano ang mga posibleng side effects? So, alam naman natin na ang ating mga alaga at asong pusa ay madalas mag-sniff and mag-lick everywhere. So, sa parang ito, maaari sila makakuha ng mga parasites sa paligid. Kaya napaka-importante to have your pets thoroughly examined by your trusted veterinarian. Naalala nyo ba nung meron kayong bagong tuta or kitten? And some of you guys experience or observe na medyo malaki yung tiyan nila and not proportion sa whole body nila. So actually, that is a sign na meron silang bulate. So, ano-ano nga ba ang mga ibang klase ng mga bulate na pwede maka-infect sa ating mga alaga? Kasama dyan ang roundworms, hookworms, whipworms, and tapeworms. So, unahin natin ang roundworms. Sila yung pinakamadalas nating na-encounter, especially sa puppies and kittens. Sila yung mga itsurang spaghetti, pababa at pataas. But mainly, during wellness exam, so tinitignan natin yung body and chest proportion, kung tama ba ang or appropriate yung size nila. No? So, dito nagkaka-idea tayo kapag medyo malaki yung tiyan ng alaga natin. No? We tend to check yung stool nila via fecalysis or pagkuha ng fecal sample, and then we'll check it under microscope and see if may mga possible parasites. So, paano nga ba nila nakukuha ang mga worms na ito? So, there are numerous ways on how they acquire this type of worms. Number one is during pregnancy is capable yung mga worms na to travel from the mother dog if hindi siya properly dewormed towards the developing fetus. Kaya it is very important na regularly deworm ang ating mga breeding dogs. Second is the transmammary transmission, wherein during nursing, nai-infect sila as the dormant larvae na madalas na nasa muscle tissue ng dam ay nagta-travel towards the mammary gland. And then lastly, the direct infection, wherein yung mga eggs na nasa environment ay directly na-ingest nila, usually during playtime or kapag nag-nurse sila sa mother dog. Kaya it is very important to maintain a good hygiene practice sa ating mga pets. So after ingestion, magmamature sila sa bituka ng ating mga pets, which can cause gastrointestinal related problems. And by the way, before sila makapunta sa site of infection nila, nagta-travel muna ang mga larvae sa different tissues ng body, mainly sa liver, which is related to liver-related problems, and also sa lungs, which can cause pneumonia. So next, yung hookworms. So, mas maliliit lang sila compared sa mga roundworms, sizing around 1 to 2 centimeters. Pero mas pathogenic sila, or ibig sabihin mas delikado due to the fact na mas aggressive sila, mas sumipsip ng dugo, which can cause anemia. And dahil sa damage na nakakos nila sa intestine, ang nangyayari, it can also lead to diarrhea. And if left untreated, yung ganitong condition, may tendency magkaroon ng penetration yung bacteria sa intestine to cause systemic infection. There are cases na kapag mataas yung worm load ng mga hookworms, dahil sa sobrang anemia na na-cause nila, kailangan natin mag-perform ng blood transfusion to save them. Kaya napaka-importanting i-take note sa parasite na ito or sa worms na ito is yung ability niya to penetrate the skin. So, hindi lang sa ating alagang aso at pusa, kung hindi pati na rin sa tao. Kaya we always advise na always deworm your pets. Lalo na if we have kids na madalas makipaglaro sa ating mga alaga. At the same time, kung saan mga areas na madalas yung mga pets natin, gaya sa bakuran, yung mga nasi-shed nilang eggs na nag-hatch into larvae, so that larvae may penetrate the skin and can cause skin irritation. So another worm na pwedeng mag-infect sa ating mga alaga at asong pusa is yung whipworms. So maliliit lang din sila, sizing around 5 millimeters. So madalas sila makita sa large intestine, specifically sa cecum. So nakukuha ng mga pets natin ito via direct ingestion of eggs. So one special characteristic sa type of worms na ito is yung resistance ng eggs outside the host sa environment. So ibig sabihin, yung likelihood ng reinfection is mataas. And pwedeng magkaroon sila ng long-term source ng eggs, especially sa area. So, gaya ng ibang mga worms na na-mention, pwede rin ito mag-cause ng diarrhea and also dehydration. So, lastly are the tapeworms. So, yung mga tapeworms, these are the flat-segmented worms na usually na-acquire ng ating mga alaga via ingestion of infected fleas. So, fleas, worms, so paano? So, di katulad ng mga previous or mentioned worms natin. Tapeworms require an intermediate host wherein necessary ito for their development and transmission. So, yung mga pulgas, sila yung maliliit na mabibilis na yung mahirap hulihin na nakikita natin sa ating alaga, will ingest yung mga eggs, no? And then, that egg will mature. And the moment na na-ingest ng mga pets natin yung infected fleas na yan, especially by grooming or grooming other dogs or cats. So, dun sila nagkakaroon ng ingestion. So, after ingestion, nagkakaroon ng development yung tapeworms. No? And then, special characteristic ng tapeworms na to is their segments. So, kaya nilang mag-detach na segment nila for them to reinfect. So, their original body will stay or nakastick pa rin sila sa intestinal lining. And then, yung mga small, mga portion ng segments na yon or mga segments na yon, magko-crawl out sila, no? Sa anus, no? Which irritates the anus ng pet. So, tendency, doon natin napapansin yung scooting or yung niro-rub nila yung anus nila sa floor dahil very irritating to. And most likely napansin nyo na to sa mga pupo nila. Kung meron kayong parang napansin na parang bigas, pero kung titingnan nyo sila, is parang silang gumagalaw. So actually, those are the segments of the tapeworms. So which contains yung mga eggs, and then as the life cycle goes, so yung mga pulgas, makukonsume ulit yun, and then ingest na naman ng alaga natin. So very important din to take note is yung external parasite control. Although we will make another video for that para mas ma-focus natin at ma-discuss natin yung mga importance nito. So, kailan nga ba nagbibigay ng pamurga or dewormer sa ating mga alaga? So, for puppies, we usually start deworming at the age of 2 weeks old, given 3 times every 2 weeks interval. And then for cats naman, for kittens, we usually start at 4 weeks old. And same, given 3 times every 2 weeks interval. But this is a general guidelines na sinusunod natin. But your trusted veterinarian will make a different plan. Depende sa physical examination, sa history, or sa kung anong signs yung mga makikita sa ating alaga. But here in our practice, after nilang na-complete yung 3 deworming sessions nila, so we usually maintain either monthly or 3 months. Depende kasi ito sa lifestyle ng ating alaga. So, the more na mas active sila, let's say outdoor, mas prone sila sa exposure ng mga parasites, which is nire-require natin na monthly ang deworming. So, let's say sa mga indoor naman, so we usually require at least every 3 months. So, lesser the exposure, so lesser the deworming. So, dahil alam na natin kung paano nagkakaroon mga alaga natin ng mga parasites, and at the same time kung paano ito ay maiwasan. So, huwag tayong masyadong magalit sa mga breeders. Let's say, just in case meron kayo na bili na bagong puppy or kitten na may signs of worms. Dahil alam natin yung mga possible scenarios, no, na pwede nila ma-acquire ito. Especially sa aming mga vets na baka i-advise sa inyo na ilang beses i-deworm yung ating alaga. Kasi we do know yung mga possible chances na maka-acquire tayo or maka-acquire sila ng mga parasites from the environment. So, just a gentle reminder, always have your pets regularly checked and have them dewormed. The most critical part of our pet's life is their first few weeks, wherein dito pala nagkakaroon ng development ang kanilang senses as well as establishment ng kanilang immune system. So, sa phase na ito, nakadepende pa lang ang katawan nila sa maternal antibodies na nakukuha sa colostrum ng mother dog or cat, which is ang colostrum ay packed with immunoglobulins At nakadepende dito ang mga survival ng mga puppy and kittens. Pero hindi magtatagal ito. Mawawala din ito for some time. So, dun papasok ang vaccine. So, the main infectious diseases that we want our pets to have vaccine against includes parvovirus, distemper, leptospirosis, rabies, and 2 other viruses na usually related sa liver and respiratory problems. But mainly, ang pinaka-common natin na-encounter dito sa ating bansa is the parvovirus and distemper. So, maybe we will make another episode for us to talk about these 2 viruses in detail. Then for cats naman, we have panleukopenia virus, wherein yung mga infected cats show signs of parvo-like symptoms sa mga dogs. We also have herpes virus, calicivirus, and chlamydia, which mainly cause respiratory infections. Also the rabies, which is widely feared virus na pwede mag-infect din sa mga cats as well as humans. So for dogs, in general, we usually start vaccination as early as 6 weeks of age. So ideally 4 shots with the interval of 2 to 4 weeks. But we usually advise yung mga clients natin to come back for booster shots after 2 weeks. Dahil na rin we consider yung mga unexpected events and yung possibility na hindi available yung ating mga clients. So at least, pasok pa rin sila dun sa recommended interval for booster shots. Pag nakumpleto na nila yung 4 na beses na bakuna, we do require na give it annually. But your veterinarian will likely modify the initial shots based on physical exams. Because as much as possible, we tend to make sure na fit for vaccination ang ating mga alaga, kasama na dito ang kanilang pagiging worm-free. Then for cats naman, we usually start vaccinating our cats as early as 8 weeks of age, given only twice with 3 to 4 weeks interval. At the age of 3 months, on both cats and dogs, usually we give the first anti-rabies, which in our practice given only once, and then annual. For older pets naman na hindi pa nabakunahan, we can give the vaccine anytime, as long as your veterinarian will have thorough examination na fit yung ating alaga for the vaccination. So that is it. Hopefully marami tayong bago natutunan sa mga sakit na posible makuha ng ating mga alaga at kung paano ito maiwasan. As for the saying, prevention is better than cure. So always have your pets checked by your trusted veterinarian and have them dewormed and vaccinated. So if you learned something new today, please leave a comment below. We'd love to read it. We'd love to see you back here again for more pet health related videos. And if you like the video, please click the like button and subscribe to our YouTube channel. And don't forget to hit the notification bell para updated tayo sa latest videos. If you want to find us, we're located along Bertha Street, Mountain View, Balibago, Angeles City. Facebook page, New Valley Veterinary Clinic. Bye!